Sorry, everybody. Thank you, Berto. I didn't see you message, and now we should be on volume. So to recap, we are covering chiropractic and pregnancy and why it is so important. So I'm going to step back for just a second now that everybody can hear me and share with you that we're going to discuss how it supports the body, our role in supporting pregnant mamas and that process for them, as well as the baby, and what can happen when there's an abnormal labor or what causes that. And then a technique that is used that Doc and I are certified in, that is a technique that is phenomenal in supporting mom's hips and pelvis and the uterus in being in the most optimal alignment for the most possible ease in delivery and labor. So back to where I was. We want a greater comfort, obviously, for mom and for baby, and just that natural care and not having to go through a more medically induced or intervention if we don't have to, that the body is designed to do this process and has for hundreds and hundreds of years. And so the less intervention we need to do, the better it is for mom and baby. And there's research we'll get to at the end that talk about that from both obstetrics and naturopathic routes like chiropractic and acupuncture and different realms there. But body going through its alterations and preparation for a baby, puts stress on mom, puts stress on ligaments, puts stress on the structure. And as that shows up, it's many times a pre-existing or an unnoticed imbalance that was there in the spine and pelvis to begin with, that just wasn't enough to cause a disruption in their day-to-day or a noticeable discomfort. So a lot of times pregnancy, as we get through that first try, bring to light things because of what the baby's weight does to the pelvis. And there's a lot of rapid growth that happens, and that's normal adaptation. So as the baby is changing and growing, it's putting a normal adaptation of stress, but it's rapid growth in the uterus. And so that changes things to the pelvis. So due to that growth, the baby's and the interferences to the body's normal structure has an adaptation that it has to do to that growth. And so we want obviously more comfort for mom, but comfort for baby too. So when there's stress in the uterine walls and on the ligaments, that puts stress upon the baby, not just mom. So again, another reason chiropractic is so helpful is because we see less intervention, which creates just safer births all the way around. And we'll get to, again, some of that research in a little bit. So again, we see a lot of decrease of symptoms and through adjustments and the correct pelvic exercises and the correct type of adjustments. So the way we adjust a pregnant mama is very different than we adjust someone who doesn't have all those hormones and ligament differences happening in their body. So going on to, we're still seeing that on the top of the screen. Do we always? I don't know. Comfort and support to mom and baby, right? So the spine and the pelvic stress that are put upon it, we need to support. Like we were talking about, when that rapid growth happens, there's interferences to that normal structure with that growth. Now that's normal to have happen, but it puts a different stress upon the sciatic nerve, which is a nerve that runs at the very low back at the start of the hips and pelvis. And with the forward and tipping and the opening that the pelvis has to do through the pregnancy, that creates a stress on that nerve. It also creates different muscles around the hips and low back to engage and try to support that forward tilting that's happening. And so everything we can do to support the pelvic floor, the pelvic wall, and the muscles around that core of your low back minimizes, and of course, proper alignment then when there's not an imbalanced ligament or structure, decreases that sciatic tremendously. And sometimes it doesn't even happen at all for moms. Another component is obviously through adjustments, eliminating the causes of some of that stress, like I was just alluding to. So the more we have a proper alignment, the better. So getting into what's changing on the inside during the pregnancy and why things happen is, the uterus enlarges and it's accommodating that that rapid growth. So we have to have a balanced pelvis, which really equals the ligaments that are holding the pelvis in place, that are connecting to all of those structures of the bone, of low back, hips, front of pelvis, and back of the pelvis and sacrum, have to be equalized to support the suspension truly of baby inside in the uterus, and then mom structurally on the outside. So again, when we see an unbalanced pelvis, those things are becoming torqued or twisted, and then can create an uneven pull that puts stress upon the babe, especially as the baby develops and is bigger inside, but again, also puts stress on mom. But there's a lot of studies that they're doing, as well as just scans when they're looking at stress upon ligaments and where torque is involved, that creates stress into the pelvis, and the pelvic wall, which is then what the supportive suspension is doing with the uterus. So that uneven pull on the uterus is definitely putting stress upon the baby. As the baby gets bigger, what happens is it then restricts the baby's movement. So internally. So it may be more stress in a different way with the way when the baby's smaller, but as soon as the baby starts getting bigger, this uterine tension creates these types of an effect. So if we have a torque or twisted ligament, and I apologize, I was trying to pull some really great pictures of what the pelvis looks like and where just those muscles are, and the ones that were affecting the most and supporting the balance in the most. And I couldn't pull the best pictures that I wanted. So we'll add that for next advanced topic on this in October when we do it again. So when we get to that, it may make more sense where those ligaments lie. But when they're torqued or twisted, they're putting that uneven pull happening. When it starts to, the baby starts being big enough, it's restricting the baby's movement. So this is, again, not optimal position for mom, but not optimal position for baby in the uterus either, as the baby's growing. So that compromised position of the baby will overall then long-term, if that tension isn't released, can affect their growth and development. An example of that is how a baby sometimes will have what they call torticollis, and that is a baby coming out with a very tight neck, and it cannot straighten the neck. It cannot go here, and it can only usually turn one direction and not the other. That is longer term stress that's happened in the muscle of them being like this in utero as they're growing, not just they came out an imperfect, if you will, or way of sometimes the torque and tilting and pulling at the head definitely can create this, but so can just that development effect while they're in a compromised position, being bent like this instead of being able to come straight through the canal this way. So that's one that people know that name and tend to see. We see a lot with babies is when there's just one-sided dominance in that tension and they can't even move the neck properly. And if they're already like that in utero, then they cannot come out as easy when their head is tilted and like that, rather than if it's got room to do this and to come straight through the canal that way. So it's a harder birth position and process on them, and even on mom's pelvis, to have the head tilted. So getting into what that's called, or what as birth approaches and the uterine tension is there, sometimes the baby, or what they'll diagnose or call what is difficult labor is this dystocia. And it's really defined as it reads, pain or exhaustion caused by that long or difficult labor. It's usually leading to multiple medical interventions that, again, can be traumatic on mom and baby, and that just prolong the process. So when interventions come into play, that is things like the Pitocin, epidurals, things that are meant to speed the process along, or induce the labor. What happens when that happens is it's more stress on mom and baby. It's also forcing them out at a pace that's not necessarily natural pace for them to be exiting. And so an episiotomy is when the baby's exiting, it can be from their head or from other parts of the force of their body, like their shoulders. It literally tears the skin of mom from one end to the other. And that has to be an immediate surgical, like stitching of a body, of the area opening up beyond where the baby's, beyond where the natural process of where the baby's coming out. It is done so forcefully or come out in such a sometimes improper position that it does tearing to mom's skin in that area more than it should. So there's sometimes there has to be some repair work that happens after the baby's out. What also can create, of course, that stress and trauma upon mom and baby is if we have to do more of a forceful pulling, or they go in to bring a baby that's in a poor position out, then they're getting in there and using their hands to try to maneuver the head out, to try to maneuver the shoulders out, because the baby's not lined up along the pelvis evenly to come out the canal. Or if mom's pelvis is torqued or tilted, it isn't at an even rotation to allow the baby to come out as naturally. So when we have to create those things, now the most force is getting into things like the vacuum extraction or the forceps, and this can happen when the baby is stuck in the canal improper, or isn't turned. So the baby should be head down and should be rotated to where we would come out smoothly this way, and not necessarily where and then the shoulders, and then they can rotate and kind of turn you forward, but we don't want that posterior presentation. So that's kind of coming out in that reverse direction or reverse way. So with that, sometimes those tools are used in C-sections, but more so when I feel like a baby is stuck in the canal, that they're kind of grabbing by the head or literally putting the vacuum on the head. And that causes a barrage of other brain and nervous system stress because of the amount of force that's just put upon the skull itself. But again, upon the neck and the rest of the body, just getting the baby out. So anything we can do to create that process to be smoother, we want to do for baby and for mom. So undesirable are some of the things I just mentioned, right? Is that we have a head tilt off to one side, or worse, more of that posterior position. Even if the baby is head down, if it's not turned the proper way, that is not a natural way to come out. So a lot more stress on baby. Or something like there's no room for the head to move down. If the baby is also stressed in that torqued position, a lot of times the baby then they know that's not natural, or they can't twist and turn. Sometimes it becomes extreme to where that's happened, and then the cord can get wrapped around them in ways that they just know, oh, I can't twist and turn, because that creates more stress with the cord being wrapped around a part of the baby, or sometimes even around the head. So when a baby doesn't turn and go face down and stays feet forward, there's usually other components to that. And that's what they call a breech birth, is when their baby's feet first, feet down. So any position that's slightly off during that birth process traditionally slows down labor and adds pain and distress. Now I feel like I am an exception. I was a breech baby and I came out super, super easy, but I feel like I don't hear stories like that often at all from patients and mamas and other people that I know. So I think there is, because more often than not, it tends to not be as easy, and as on mom and baby, you hear that they always want to try to have the baby turn. And unfortunately, now I feel like the medical world has gone to intervention of that's just an immediate C-section. And that's what I hear mamas in their 20s and 30s telling me now, that they aren't even given an option to do something different. With that, this is why chiropractic to us is so vital in care. So going through the fact that there are studies, even in obstetrics, that shows the most common reported reasons for that dystocia is the inhibited nerve function, pelvic imbalance, and baby's position. And with what we do, isn't it nice that we address all three of those things, right? So an inhibited nerve function means a baby is not thriving from development in utero. First thing to develop is brain and spinal cord. So we know how important that is in chiropractic, that babies receiving that optimal function and nerve flow and ability to thrive and develop on the inside for those 10 months from day one. So there's a study I put in here that actually isn't related to chiropractic or to pregnancy. but is studies that have been done over year periods of time that shows when patients have a primary chiropractor and that they're under regular care, that there is 60% less hospital admissions, almost 60% less days spent in a hospital. Again, in the 60 percentile of less outpatient surgeries, and much less in the pharmaceutical costs, because people are not taking anything from over the counter to the type of things that are people are being prescribed. I feel like the blink of an eye for pain that isn't necessary. That we see a huge reduction in the patients and people that are under regular care. So we see similar things when a mom can go through care through that whole pregnancy and what studies show. So I'll pull up a couple articles that people can copy the links on, or go back to our slideshow and look those up. And we can give you tons of them if you would like more of them. If you're somebody that really wants to look at research and look at studies that are being done. So what studies with chiropractic show is that, again, you're restoring that nerve function to the uterus as best as possible. Sometimes those imbalances that, again, mom didn't even know were there start showing up. So you're balancing out those pelvic muscles and ligaments. Obviously, then most often leading to a safer and an easier delivery, a shorter labor time, but also just the adjustments through the nervous system is strengthening the ability to overcome nervous system stressors that mom experiences and baby experiences. We also know that there's the research that shows just a boost in the immune system. So mom is doing work for two, right? She's got her own body to support, plus an entire other human she's growing in there. So the body needs sometimes like almost a double dose of all kinds of things and support nutritionally. So a lot of things come into play here. And what better for the baby to get all those nutrients it needs to get from mom is having that free flow of nervous system and support through the uterus from umbilical cord from baby to mom. So lots of things have to flow. Hang on a second, I lost my clicker. There it goes. So here's one that, yeah, I was afraid it was going to come out fuzzy. Okay, so we may look at another picture, but there are ligaments, and when we get into talking about the Webster technique here, it's where the ligaments change and which ones are so important in a technique that we use when adjusting and checking mamas. And we're really looking at the ligaments that do a lot of change and that support intrautero is the ones, let's see if I can kind of point to them with my mouse. Again, I'm white mouse on the white ligament, but it is coming through the sacral ligament, and ligament right here along the side of the sacrum here. So what you'll feel what we do when we're working on mamas is it's this contact point of the ligaments right as they come along the side and attach to the sacrum right here. And so we'll test the difference if there's tone difference and tension and that torque, either on the left or the right side. Another part of that Webster technique is also checking the piriformis, which that is the muscle and the ligament that runs right here down to the tuberosity. So the one that's kind of running in that upside down V shape right here on the left and the right. The sciatic nerve that's leaving the back right here runs down both sides, and it sits right next to the muscles that sit right by these ligaments. And so when we're doing holds there, we're releasing tension and torque on those ligaments. And then the muscle that tends to run and rub right against that sciatic nerve that creates that sensation down the back of the leg or the buttock and the thigh sits right here alongside of that ligament and gets very inflamed from the tipping of the pelvis or the torquing of the pelvis. So that muscle is one we need to know how to stretch properly, and we need to know how to release and get as balanced in tone left to right, because many times the sciatic is just getting rubbed against because that muscle is inflamed. So it's enlarged and it's bigger than it should be. So it's rubbing up against the nerve and it's causing the stress down here at the bottom of the pelvis, if you will, rather than right up here, which it can also do at the low back where the nerve exits the spine. So there's a couple different components that we have to look at, especially with mamas as they get into that second and third trimester and the pelvis is pulling them forward. So again, this is a picture that I will get a much bigger version of to where I can put it onto the slideshow, so you can see the ligaments in the front and in the side there. So it's kind of a side and belly view of the ligaments that are holding right here in the front that we were working on. And then I was trying to show the ones here in the back. So I apologize. I will find better pictures for next round so that someone can see the front view of that with the belly out of the way. I had one and I don't know where it went, but I couldn't find it today. So the ligaments that we're addressing are on the front of the pelvis on the left and right side. If any of you have had psoas work done, it's in a similar area. And so this is me just wanting to show a picture of the differences as we start talking about the Webster technique and how Doc and I use this to evaluate and support the pelvis when things are malaligned. So the left is the female pelvis and the right is the male. So much more oval versus round for that exact reason of allowing a baby to come through it. So the pelvis has to literally open up and then drop this way. So kind of in a sense, drop out and then open. And so there's all that happens when the hormones change and then those ligaments get more lax and loose. So all the more reason we have to be on top of checking that frequently, because the laxity has to be there. That relaxin hormone is there to allow for that to open up and move, right? It has to create space for the baby and for the baby to develop and grow and then drop into that canal. So as that movement happens, we want to make sure it does it in an equal way, left and right, so that there is no imbalance or stress there. What that also creates is that laxity, that hormone stays there through the whole entire pregnancy and the delivery. So it can create things to feel kind of unstable and looser than what it normally feels like, right? So that's why pelvic floor and a lot of work through the pelvis is great to be doing through the pregnancy, even pre-pregnancy, but especially during, because it's just supporting that strength of the lower pelvic floor muscles that a lot of us don't really engage and use and even know are there until they're not there. And then you experience things that are not so fun when those pelvic floor muscles aren't strong. So it's something that with the technique, what is specific chiropractic analysis that we do and what we call a diversified adjustment. So it's areas that we're looking at that are imbalanced from left to right, front to back. And really the goal of that adjustment is reducing the effects of the subluxation, right? Or that SI, the hip joint, which is where right here, your sacrum meets your hips. So a lot of movement happens right there. And this is, where the spine comes in. And the left and right side is where the tailbone meets the sacrum, meets those two hip joints that move quite a bit. So there's a lot of stress that gets placed upon the SI joints right here. So that's the start of some of the analysis, is that joint dysfunction or that change in torque and imbalance. So in changing or doing so with this biomechanical function is really that sacral or pelvic region function and motion improves. There's all kinds of things that talk about, and I just kind of pasted in a technique and definition and application abstract really to talk about the development of Webster, when that came about, which was in the 1940s. That technique has really been observed clinically and associated with the improvements of pregnancy outcomes. And the ICPA stands for the International Chiropractic Pediatric Association. That was founded by Dr. Webster and is something that promotes and defends the chiropractic care of children and pregnant women. It is really the advocacy there to, again, support that there's other options and choices for naturopathic care, and things that support the ease of the process of the delivery and labor. So it talks about the objective and the discussion around that, but I mention it just because that is actually, I think when I met Doc was actually doing our ICPA certifications back in the day, and that Webster certification is something we both have. Our combined practice experience between the two of us is about 25 years. So that is something that if you are not in this area, or you're watching this because you know of a mama, or you know of somebody in your family or a friend or whatever that is not in Colorado or in Denver, There is, through the ICPA, those Webster certified docs. If they are certified through this association, you're listed in that site. It's really easy to go look up the ICPA and just click on what doctors are certified, and it'll take you to finding somebody in your region or your neck of the woods, because it's very invaluable to have that tool in your toolbox and be utilizing that and have that in your self-care regimen through your pregnancy and post-pregnancy. So if you're not in this area, you're thinking of somebody that you know that is pregnant or that is to become or already going through the process, that doesn't really, I would say if you haven't started, it's okay. Even if you're partway through a pregnancy, I mean, anything and starting anything you can, whenever you realize it's something that could be benefit, is better than not doing it at all. So I've had people say, oh, well, I didn't start at the beginning of my pregnancy. That's okay. Let's work with where you are in the middle of your pregnancy. I mean, anything that just brings more support to the baby in those latter weeks and months is vital. So I did put an article here that just talks about different things through the Pathways Family Wellness Organization. And that is just different topics on mom's pregnancy, the Webster technique itself, research around the safety of it and why it's so utilized. Because really the misnomer is that anybody's turning a baby. With the Webster technique, what this is it's allowing the pelvis to be in the proper alignment through releasing that torque and tension. Then the body and the baby and all the things that the body's wisdom knows to do does that process of going, release of tension, things are where it's supposed to be. The baby then turns, flips, repositions. We see it all the time. We saw it with ourselves during our pregnancies. And it's just vital for families seeking out chiropractors or chiropractic to be finding someone who's proficient in that technique, because it's a way to just have that more comfortable process through pregnancy for mom, but definitely the ease in the process of delivery for the babe. So don't know if I got a slide on there. No, it doesn't. But I would end with just the who, like we always do. Who do you know? Who do you know that you might want to share the link to this workshop that'll be posted on YouTube this week? That is either having a baby, talking about having a baby, maybe is in the middle of a pregnancy. Even if it's a mama who has had a kiddo. I mean, the most important thing is that the pelvis has to come back to its original, in a sense, position. And so those ligaments need support coming back to where they need to be post-delivery, as much as supported during the delivery process and the labor. So when there can be more pelvic pain for moms is sometimes after the delivery, because things haven't come back to their proper position, and the stress upon mom then trying to heal and care for baby and do all of the things, and then carry a baby. I see a lot of sometimes more low back pain with moms coming in post baby saying, oh my gosh, this is not going back to what it felt like before baby, or now I'm in this pain and I'm trying to carry a baby around that never gets lighter, that is creating more discomfort than I had even when I was pregnant. So that's a lot of other pieces about supporting the pelvic floor and working on realigning things so that, again, there's less stress on mom as she's got to do a whole different set of tasks post-baby, and getting her body and her ligaments and her structure back to a stable, supportive place for her for the rest of future. So if it's even someone that has struggled or hasn't been checked post-delivery, it's always a good time to get checked. So if we can help find someone in your area, otherwise I'd say the best resource is going to the ICPA website, and you will find the link to find people in your area. So thanks for joining us tonight. It was lovely having you, and looking to hear your takeaways when you pop into the office this week and next. Also a reminder, next week is our Patient Appreciation Week, and there's going to be so much fun happening in this office. We are doing a very beachy luau theme with the nice 90-some degree weather we're having all week and next week. So come join us, come have fun, come have snacks and treats. Of any of people that you know that are interested in getting checked, we may have one slot left in the week next week, available on Wednesday afternoon. So if anybody's still thinking of someone that would like to get in and get checked, that entire visit, exam, consult, and x-rays are on us. So we would love to support anybody that you care about that you would like to have checked in our office. See you next Tuesday looking forward to our topic on vital needs. Bye, everybody.